So I know those were two very, very different videos, but I kind of wanted you all to see the second one so you know a little bit about me and why I feel so passionate about reaching people. So this is probably my third or fourth presentation on this topic. I am working with our local Boy Scout Council in my home community of Louisville, Kentucky. We're doing tick-borne disease education there. I'm working on developing a class for them that will teach Boy Scout leaders at their scouting university next January when I get off the trail how to take this information and be teachers themselves. Because this disease, and part of what I wanted to communicate in that last video, is to encourage people to take this a lot more seriously than you may have been led to believe to consider Lyme. I know that is the boat I was in a couple of years ago, that it just wasn't portrayed as big a deal as it really is. It, if not caught early, can kill you. It can manifest in just about any form because it can attack any organ in your body. It gets misdiagnosed chronically because it's a mimic disease, they call it, because it could show up as heart problems, it could show up as psychological problems, it could show up as rheumatoid arthritis, autism, Alzheimer's, ALS, MS, fibromyalgia, chronic fatigue. All of those are diseases that to this day don't have a known cause. And they have exploded in their own right over the last 50 to 60 years, along with Lyme. I'm not saying 100% of those are caused by an undetected infection, but there is growing evidence that untreated infection can ultimately result in those kinds of illnesses. So we want to take it seriously. So what I really want to talk about with you guys in our short time together today is the things that if I would have known 2 years ago, I would not have gotten Lyme disease, and I want to pass it on to you. So one myth I want to bust is a tick has to be attached for 24 to 36 hours, or there's virtually no chance you can get Lyme disease. It's absolutely not true. I found out after the fact that there is no research that has definitively proven that it was an assumption based upon the feeding cycle of ticks, in that it typically, in the 24 to 36, 48 hour mark, when a tick is concluding its feeding on you perhaps, it regurgitates the contents of its gut, of its stomach. And the theory was that the bacteria only resided in the tick's gut, so you weren't getting offloaded bacteria until that period. But there's never been any research to prove that the bacteria only resides in their gut. As a matter of fact, there's recent research that it survives in their mouth parts. So it may be a lesser chance the earlier you get the tick off, that's true. The longer it's attached, the more chance of transmission. But it's not true that if you get it off in 24 to 36 hours, you're scot-free, like I thought. You know, now if I'd had those 20 tick bites, you can bet your bottom dollar I'd have been in the immediate care center that night, and I'd be insisting on doxycycline, a generic drug that's very, very, very effective in acute Lyme when it's still in your bloodstream. So you want to get it into your system in the first 24 to 48 hours max, in my mind, after you've been bitten by a tick that you think has a very, very good possibility of being a deer tick nymph. And there's growing research. Matter of fact, there's going to be published research probably later this year that the Lone Star tick carries Lyme disease. There's no reason it can't. There's no species barrier that prevents any of the varieties of ticks that are on that tick ID card that can't carry Lyme disease. And the Lone Star tick is far more populous in the entire eastern U.S. from Florida to New England than a deer tick is, and it's much more aggressive to humans. It bites people much more often. So, you know, prevention is key in early intervention. So here's some of the techniques that I'm using now to go back out on the trail. A lot of my Lyme friends thought I was nuts to try and do this, you know, and come through what's considered Lyme endemic territory like Pennsylvania. There are more confirmed cases of Lyme in Pennsylvania than any state in the nation. You know, part of that is because it's got a large population, but it's really been growing here, and I've met a lot of these people. Permethrin impregnated clothing. Permethrin is a substance derived from chrysanthemums. It's a synthetic version of it that they use in clothing. These pants, these socks, the shirt right here, and these gaiters are all made with fabric impregnated with permethrin by a company called Insect Shield. Many retailers buy their fabric and produce clothing, like Outdoor Research makes the gaiters, Ex Officio makes my pants, Columbia Sportswear, LL Bean, all do a version of it. These are guaranteed for up to 70 washings before the permethrin loses effectiveness against ticks. Permethrin kills ticks. Same substance as in flea and tick shampoo. If they get on this clothing, they will either get off of it pretty quick, or if they stay on it long enough, they'll die. And most ticks, and I know I may be telling you guys stuff you already know as veteran hikers, are going to get on you from the knees down first. They're going to be in areas where there's high humidity, so leaf litter, overgrown areas where there's moisture. Ticks have to have moisture. They become desiccated and die very easily out in sunlight, so you're not as at risk if you're crossing an open field, even if there's grass there, because the ticks can't stand dryness. One tip for you is, don't take your hiking clothes home and throw them in the washer after you've come through an area that might have ticks. First, throw them in the dryer for 15 to 20 minutes on high heat. It'll kill every tick. They can go through cycle after cycle in the washer and it won't do anything to them. High heat, dryness kills them. So throw those clothes in there. Make sure they run high heat, as high as you can do with synthetics, obviously. It'll kill them, then wash them. But do the tick checks frequently from the knees down when you're passing through areas. Like there's an invasive shrub up in this region that's really going crazy, Japanese barberry. And that's one of the theories of why tick populations are exploding, because this invasive is exploding in a lot of regions on the Appalachian Trail, and it produces the ideal environment for ticks. High humidity, the moisture is retained down at the ground level, and they will literally, you guys have probably seen it, they'll crawl out to the edge of a blade of grass or on a leaf, and they'll hold on with their back 6 legs, and their front 2 legs have barbs down, and they call it questing. They put those out and they wait for an animal to come by, and it grabs your skin, your fabric of your pants, or the fur of an animal, and then they've hitched a ride. But it takes them a while to crawl up and get to a place where they can bite. And you've had them. You know they like places like the back of your knee, between your toes, your groin. They like places where the blood vessels are close to the surface of the skin. They're moist and they're hidden. So it usually takes them a while to get there. If you're wearing these pants, by the time they try to crawl up, they're either going to fall off dead or they're going to jump off, because they will not like that permethrin. But even if you're not wearing those, if you're doing tick checks frequently after you pass an area where you've brushed up against stuff and you think this is possibly tick territory, just stop and do a good tick check, especially from the knees down, before they've had a chance to crawl up. So I always used to do that too. Now the challenge is with deer ticks, the nymphal tick is about the size of a period at the end of a 12-point sentence, a poppy seed, really teeny. Most people that get Lyme never recall having a tick bite, because they feed and drop off and you never knew you had it. So it's really important in the spring, when most northbounders are heading up the AT, that's when the nymphal season is at its peak. Typically as early as March, but April, May, and June are the worst months. And you want to really, really, really be vigilant in tick territory, because those nymphs are so small. So what happened with me is the nymphs also stay clustered because they're so small. They start off as larval ticks after they hatch out of the egg. They're so teeny they stay clustered together. When they become nymphs, they molt after their first blood meal. They bite typically white-footed mice, which are very common at AT shelters. The white-footed mouse is the carrier of Borrelia burgdorferi, the Lyme bacteria. That's where the ticks definitely pick it up. And then they'll pass it along to their next blood meal, which the nymphal tick will bite any mammal. If they get on you, they're going to bite you like they did me. But typically they'll bite a smaller mammal, and then when they molt and become an adult, the 3rd stage of the life cycle, that's when they're going to look for a deer or a human, because they need a higher protein meal of a larger mammal than females do to be able to produce eggs. They feed on the human, or the deer, they drop off, lay eggs, and the cycle continues. It's usually a 2-year life cycle, and ticks can overwinter. They can survive the winter, and they can be active in the winter. You can get Lyme disease any month of the year, almost all throughout the United States, unless it is far northern New England where you've just got brutal winters. They won't be active there. But most of the AT, ticks can be active in December, January, February, so chance is lower, but it's still there, and you want to be vigilant. So I probably walked through, on the way to my camp, a cluster of nymphs, got them on my pants. My son was right beside me. He had 1 tick. My dog had 1 tick, and I had more than 20. So the tick checks are, really, really important to do. Now let's say you find one of these ticks on you and it's attached. Those tick ID cards and the pamphlets I gave you give you all the techniques and their websites that are linked on those cards of how to properly remove a tick. Never, ever, ever use a chemical or a match or anything like that on a tick to remove it. Because what it's going to do is it's going to force it to regurgitate its guts into you. You want to get that tick down at the base of its mouth. I usually make sure I pull out a piece of my skin. I'd rather have a chunk of skin out than have a piece of that mouth part still in me, and potentially grab that tick too high up with the tweezers. You want to get really fine point tweezers too, not the typical ones you might do cuticle work with. You don't want to squeeze them too high up, or you might actually squeeze them to the point where they're going to put their contents into your bloodstream. Do not use a chemical on them. You want to use tweezers or a tick removal tool. There's a lot of really good tick removal tools that have a twisting action. You look at the nose of a tick under a microscope, it looks kind of like a sawfish, except the barbs are all pointed backwards. It's all about staying attached to your skin. And if you don't pull that tick out slowly with the tweezers, you can break off the mouth parts. So you want to do steady pressure backwards, or use one of these tick removal tools that twists them and uses their mouth parts against them and allows them to pull right out of your skin. And those are all on the websites of those brochures. I carry one. I have one on my dog's collar, so whenever he and I are together, I've always got a tick removal tool. I keep one on my keychain, and I have one in my backpack. I've always got it, and I usually keep a small magnifying glass too. It's really hard to see these things, and you also want to speciate them. So that tick ID card shows you the pictures of the most common tick species in the United States, and it'll help you identify if it might be a deer tick. But it also tells you that every one of these ticks can carry other pathogens. They all should be taken seriously, because every one of them can pass along nasty stuff to you. The Bartonella that I had, honestly, in many ways was worse than the Lyme disease, and it had a different antibiotic and had to be treated to get the Bartonella. Things like Babesia, which can be passed in the blood supply, that's confirmed, Ehrlichiosis, Anaplasmosis, Rocky Mountain spotted fever, those are some of the examples of common tick-borne pathogens that are just as bad in their own way as Lyme disease, and many of them are just as deadly. So, those are some of the prevention techniques. Clothing, tick inspections, understanding where ticks live. Tick-proofing your yard is a great idea, because most people are getting this in their backyard, not on the Appalachian Trail. So looking at places where mice could live, or chipmunks close to your house, because if there's no hosts, then the ticks can't necessarily survive up close to your house. Wood piles, piles of leaves, you want to get those away. Overgrown areas. Think about where the mice, the rodents, and the ticks could survive in your yard, and look at changing that environment. Sometimes it could mean, and I know we all hate to do this, but removing a tree or trimming it back so you get more sunlight, because they don't like heat and dryness is a big point. So let me stop there, because I'm throwing out a lot of information, and there are people in this room I know that have a lot of experience with tick-borne diseases too, and may have things to contribute. And let me just open the floor for questions, observations, and we'll talk about what you want to talk about in our time remaining. Yes, sir.
Yeah, I've had a lot of experience all over the world with ticks in general. One thing I encountered in North Carolina, which I didn't think had ever happened, twice I had ticks fall on vegetation onto me. One got me on the neck here. The other one, I just believed it crawled there or something. I couldn't believe it jumped on me.
I've heard that.
And then my friend saw it happen another day in the woods. So they can come from above.
Kids can get them climbing in trees. Ticks bite birds. If you look at the CDC map that shows the worst endemic areas, and again, the CDC statistics are really poor, because they're only based upon how good the states are collecting data. And if you live in a state like Kentucky, where the public health officials don't think Lyme exists, that's what I encountered, then they're not looking for it. You don't find what you don't look for. And I know that straight from their lips to my ears, because I went to our state capitol and met with them. And the guy that collects the data for infectious diseases in Kentucky said to me, Logan, we're not finding it because we're not looking for it because we're not allocating any money for it. We don't think it's here, so on and on and on. But it is true that you can pick it up in different ways. I'm just talking about the most common ways where you can minimize it. People get them in trees, people get them in different ways, and I have heard a lot of stories of people talking about maybe, you know, they sense your carbon dioxide emissions when you come by, they sense your body heat, they have multiple ways to know when a warm-blooded animal is coming by, and they're persistent little critters that are trying to survive themselves.
I was talking to a woodsman about it, and he said they can feel the vibration.
I would definitely agree with that. You know, any sense that they can use, and they're good at doing it. So you just want to be super careful. Somebody asked me earlier that was going to a different lecture, but wanted to get some questions answered because he was going on a job to a tick endemic area about, do they get up in your hairline and your head? Absolutely. You know, most people never know they've been bit by a tick. Most people that get the classic bullseye rash, and probably as little as 50% of people ever get a rash at all, and less than that get the bullseye. But you could get the bullseye, and it might be in a place you can't see it. Your hairline, your groin, the back of your neck, if you're not, you know, have a partner that's checking you out every day. So if you get a bullseye rash, I do want to reinforce this. Bullseye rash is 100% indicator that you have Lyme disease. You get a bullseye rash, you should go and see a doctor. If you get a rash at all after a tick bite, that's what I had. I didn't have a bullseye, but I had an expanding red rash that I later found out is a classic indicator. You should definitely take it very, very seriously. But just because you don't get either does not mean you didn't get Lyme disease. You know, again, it could be as many as half the people never get a rash, but they develop the infection. And you can get a rash someplace other than the bite site. You can get bit on your leg and get the rash on your back. So those are some of the myths that I didn't understand 2 years ago that I definitely understood now. Yes, sir?
Yeah, co-worker. She turned out, they were treating her for chronic fatigue. And she got tested and found out she had Lyme disease. And
it's really common.
she's assuming it was from the deer going through her yard. Her dogs are out in the yard. And she knows she's, you know, brushed the dogs to get ticks off of them.
Yeah.
Never got a rash, never got the bullseye. But
it's really common. Well, you heard me talking about some of the symptoms. Some of the symptoms are the same symptoms of fibromyalgia, muscle pain, you know, of arthritis. You know, originally Lyme was called the new version of juvenile rheumatoid arthritis for the first 2 years because the kids were the ones showing up with it first. Just because they were the ones that were getting infected first, they were out playing in the fields. Then the adults started all getting it, Lyme, Connecticut, and a couple of years later they decided this is not rheumatoid arthritis, this is something else. And, you know, I talked a little bit about that in the film. Yes, ma'am? You right back here? Yeah, I think you had your hand up.
I did.
How did you write it?
I had the bullseye rash, fortunately. And my experience of identifying this Lyme, it took a while for me, and this is why. It started as what I thought was a spider bite. And then it began to spread on my side. It was bright, bright red. And I showed it to my sister after like a week, and it was about this big, and she's like, that's Lyme disease. And I was like, no, it's not, but it made me take a picture of it.
Good
so
idea.
then I started taking pictures of it, so I had like a progression of the rash. By the time I went to the doctor, it was honestly like this big, and it had started to clear out in the center, so the cool side was actually very
Really
large.
clear.
And through that period of time, but the thing that made me, that was different about that than anything, any other type of rash, was it was flat. It was just like an expanding red area. It wasn't really.
Couldn't swell up.
No. Yeah.
Expanding is key because it typically, whether it's a bullseye or not, it'll expand over time. So that can give you an indicator that it's not a spider bite, but it could be the reaction to, you know, to the Lyme bacteria.
Right.
It expands, and the classic bullseye, like you said, over time it can happen very quickly. I want to say this though, that sometimes it may be 4 to 6 weeks before a bullseye shows up. So don't do what I did and think, you know, well, I don't have a bullseye rash, I'll be fine, you know, and go weeks. If you got the bacteria in your body, you want to get treatment within, I think, and my Lyme doctor agrees, you know, 24 to 48 hours. If it's caught while it's in your bloodstream, the antibiotics can reach it really well and be really effective. But it literally does look like a little corkscrew under a microscope, and it uses its body to drill into your tissue, including your brain, passes the blood-brain barrier. Once it gets into your tissue, it gets into places where blood flow is restricted. It's not as easy for the antibiotics to reach it, and it starts using its tricky devices like rubbing off the proteins, the alien proteins, they're its proteins. It rubs it off on the surrounding tissues to trick the immune system. So the immune system thinks that rubbed off protein is the invader and starts attacking your own joints. That's why you get the arthritis pain. It is almost virtually identical in pathology in the way it presents and manifests as syphilis, which is its cousin. And you know, we know that left unchecked, syphilis will wreck you. And Lyme can do the exact same thing, and there's a lot of people. The lady that had to leave earlier is a local Lyme patient who's following my hike, who emailed me and wanted to come see this talk. But I can empathize with her completely, because 2 years ago, I don't think I could sit through a talk like this. You know, I couldn't sit up that long. And she, 10 minutes, her grandmother had to take her and leave. And she's probably one of these ones that's been dealing with it for 5-10 years. A lot of people in Pennsylvania, Connecticut, New York, New Jersey, Virginia, Maryland, all throughout this region are dealing with that. But so are they in Georgia, North Carolina, Tennessee, every single AT state, and then some, has Lyme disease and has these other tick-borne illnesses. That's definitely a myth that needs to be busted, that Lyme doesn't exist in the South or it doesn't exist in the West. It's in all 50 states. It is worse in some states than others, no doubt about it. You want to be more vigilant, you know, when you're in New England, no question. I'm glad to tell you I didn't see a single tick in Maine or New Hampshire. And one of the reasons I went southbound, there are many, but one of the reasons is it's a little bit safer. Because the nymphal tick season is typically the spring. They can still reproduce and have nymphs in the later part of the year, but you're not going to have the mass of them. The adults are active, you know, from July on into the fall. You can get Lyme disease right now, but the adults are much easier to see. So there's much less chance of getting bitten because you're going to spot them and get them off, or know that you've been bitten and go to get help. Most patients are getting it from the nymphal ticks because you don't see them. And they're so teeny, people don't think they're, you know, at risk. So that's a really important one. Yes, sir?
Two questions. One, I didn't know about the moisture thing. That's really enlightening. Therefore, a mulch around the house is probably not a good idea.
Not a good idea, you know.
Also, treatment. If I'm, you know, I pretty much go out the clothes that when you used to do the hike, but they're not treated. But permethrin, I've got a whole thing of permethrin.
You can spray it on, but I tell you what, I really recommend people think about doing. You can send your own clothing, your favorite hiking stuff, to Insect Shield. They will treat it for you and guarantee it for 70 washings, just like the fabric. And it's pretty reasonable. You know, you can get a whole outfit done for 50, 60 bucks versus going out and buying new clothing. If you spray it on, like Sawyer Products makes a spray on permethrin you can get from REI or Dick's Sporting Goods. They say 6 washings and you ought to retreat. So, you know, that's a good alternative too. Yes, Peru.
Kind of sensitive to permethrins, so I also would really recommend putting it away where they have equipment where they don't have to expose themselves to it. It's
Good point.
very toxic.
It is. And when I do it, you know, I'm doing it in an outdoor area, make sure that I'm upwind of it, so it's going to go that way.
Don't touch it while it's
Don't touch it, you know, don't touch it while it's wet. It needs to dry before it becomes, and people say, yeah, but isn't it still toxic on your clothes? Yeah, there's probably some level of risk of that, but let me tell you, I'd rather be risk to that than the Lyme disease, having had it, you know. Yes, ma'am.
And the second thing I wanted to say was be careful where you put your equipment. I've had Lyme disease twice. The only place I've ever found ticks on me is on my upper body, my arms, my
Backpack.
shoulders. Exactly. I think I've been very careful about where I sit me.
I took my
But I'm not
backpack
careful
before I
about
started,
where my back.
hung it up. I took my hammock out and I got the spray on stuff and I treated the bottom of the backpack, the sides, anywhere that there was cordura where the stuff would bond to it. You're not going to be able to do it with Cuban fiber or other stuff that won't be able to bond, you know, to the fabric. But I also treated the ends of my hammock, my tree straps, anywhere the ticks could get on and try to make it to me. You know, why not?
Mice can get on too.
Say-
Where mice can get on too.
Where mice could get on too. Yes, sir.
In your opinion, where's it going? Is it getting worse, or is it?
It's spreading.
That's what I want to know.
It's spreading. I think there's and this is not just my thoughts. These are, people that are doing the research. I've met with our leading tick entomologists at the University of Kentucky, and others throughout the country. Things like these invasive plants that may be creating environments where the ticks can survive in larger areas, like this Japanese barberry, that can be a contributing factor. Deer populations increasing can be a contributing factor. It's important to know that deer, though, appear to be immune from Lyme disease. They're just carriers. They spread it because they take the adult ticks a little further out. When that female finishes feeding, she drops off and the range is extended. All you really need is a climate that's okay. And because these are like cockroaches, they can survive darn near anywhere. It doesn't take, a great perfect climate for them to expand. They need hosts like the mice, the white-footed mouse. There's also confirmed research that they can pick up the bacteria from reservoirs even through cold-blooded species like lizards. And that's research from California, because California has a lot of Lyme disease from a slightly different species. The Ixodes pacificus is the name of their black-legged tick, which is really related to the deer tick, and that's Ixodes scapularis. But again, research ongoing. Other ticks are probably carrying, Lyme as well.
It sounds like it's exploding though. I'm hearing more and more about this.
It's exploding in part because of awareness. People are finally figuring out that, fibromyalgia, again, didn't exist supposedly 50, 60 years ago, does not have a cause. People are going and getting tested, finding out they really got the Lyme bacteria, getting treatment, and their fibromyalgia is gone. You got people recovering literally. And this is all in Under Our Skin. I want to give a plug again for Under Our Skin, especially to hikers. 90 minutes, you will have a much better holistic understanding of not only the pathology and the precautions you can take, but why is this expanding? Because we're not responding in a more holistic way as a public health effort across this country to prevent more people getting it. Because if it can be passed sexually, if it can be passed through the blood supply, if it can be passed from mother to child, that's spreading it a lot faster than the ticks are. And I've not talked to any scientist that's given a plausible explanation that you could rule those possibilities out.
Because syphilis can be passed.
Absolutely. And I have personally, having worked at the Red Cross, I talked to the guy that runs infectious disease prevention for the American Red Cross, Dr. David Levy. And when I found out I had it, I was also a regular blood donor, and I really wanted to know, what are we doing to prevent people that are sick but may not know it donating blood? And I want to make sure that I'm not slamming the Red Cross, because the FDA sets the standards for what questionnaires any blood bank uses, and the Red Cross just does about 40% of the blood supply in the U.S. So the questionnaires are mandated by the FDA. And I said, Dr. Levy, what do we ask in our screening questionnaire that has anything to do with tick-borne diseases? You know what his answer was? It really irritated me. The only question that's asked on that questionnaire that has any relation to tick-borne diseases is, do you feel well today? I said, you're kidding me.
Wow.
We don't ask them if they recall a tick bite? No. Because they've done studies that say there's no statistical correlation. Most people don't remember being bitten by a tick, and it wouldn't improve the screening process. I felt fine for the first 2 months after I was bitten and could have donated blood. There has been no clinical research to prove that Lyme cannot survive in the blood supply. His response to me was, we have no confirmed clinical cases that it has been transmitted. Which I will tell you was a true statement for the AIDS epidemic until it wasn't. And that irritated me. That's part of why I do get angry when I talk about this. But I'm trying not to be an angry advocate, because that just turns people off. I'm trying just to get facts out. I'm trying to share with you what I wish I would have known when I took my son, my child, into a risky environment and didn't know what I needed to know. My saving grace is he didn't get sick. I did, and that makes me feel a lot better than the other way around.
What can I do to convince my neurologist that I have Lyme disease?
You may have to give up on that one.
The patient says she has Lyme disease.
This is what people experience all over this country is dealing with physicians who are getting most of their information about Lyme from organizations like the CDC, who to this day maintains that Lyme is hard to catch, easy to cure, 2 weeks wipes it out 100% of the time, and if you still got symptoms, you've got some post-Lyme syndrome, they call it. That is another reason why this is spreading, is because we're at the highest levels are not taking this seriously. Now the CDC just came out 2 months ago while I was on the trail and reversed a decades-long. I've got a third video where I talk about this because this is big news. CDC has been saying 25 to 30,000 confirmed new cases of Lyme a year based upon these really archaic reporting protocols. Like my case never got reported through Kentucky's public health, and I'm not one of the statistics that says, but they reversed that and they said, we think our statistics have been wrong and we think the annual infection rate is 10 times that much. They came out publicly and said it's 300,000 a year. And that's a lot of Lyme. Convincing a neurologist who's been convinced that Lyme is not an issue may be more trouble than it's worth. You may need to go find a different doctor. So let me mention that really quickly, is where to find specialists in Lyme disease if you ever think you have it and you don't like the answers that you're getting from your current medical practitioner. People need to be their own advocate. You know, people ask me a lot of times when I talk about it, are you a doctor? No, but I laid on a couch sick for a year reading anything and everything I could find out about this because something didn't add up and I wanted to get well. So I became as educated as I could so I could have positive but assertive conversations with medical practitioners. There are doctors called Lyme literate medical doctors that take special training from an organization called the International Lyme and Associated Diseases Society, specifically on how to treat and identify tick-borne diseases. So they call them Lyme literate medical doctors, LLMDs. That's how I found my doctor.
Well, Joseph Burskano out there in
Yes.
Missouri got in trouble. And the one we had
Burskano was in Massachusetts.
in Saginaw, Michigan,
Yep.
got in big trouble.
Yeah, a lot of them lose their licenses.
You guys in Kentucky safe?
We don't have any doctors in Kentucky that are LLMDs. I have to go out of state to see a doctor. And that's really common down south. Tennessee doesn't have any, Georgia doesn't have any, Alabama
Could
doesn't.
you come closer?
I'm sorry.
Could you come closer? I don't
Yeah.
hear what you're saying.
Kentucky does not have any Lyme specialists, no LLMDs. Most southern states don't. People have to travel out of state to go see one.
Well,
You've got them up here because you've got so much Lyme disease. But even up here, most of them are being persecuted if they're treating outside the guidelines, like giving more than 2 weeks of
Yeah.
antibiotics.
So they're told that they can't treat Lyme patients anymore.
They're persecuted. The insurance companies file complaints against them, the medical boards of the states, and this is all in under our skin. You know, this is really, I got to say, ironically, I watched that documentary 2 months before I was bitten. And it still didn't sink in, you know, to me how to take this stuff more seriously than I was. Under Our Skin is a great resource, and you can watch it free on the internet. It's a documentary about Lyme disease called Under Our Skin. And I highly recommend, if you want more information, including where to find doctors, Dr. Burskano that you mentioned is profiled in that film, is watch that movie. You can also go to my YouTube channel. You know, I've got more information there. I've got information on my trail journal, written information that you can print off, links to other resources like LymeDisease.org in California, Lyme Disease Association, which is on the East Coast, more in this region, Tick-Borne Disease Alliance, a lot of these organizations that have come up in response to the spreading epidemic. But you know, there's good information, and the brochures that I gave out this morning are ones that I use in my Boy Scout classes. Yes, sir.
Yes, I've had lunch twice now, and just recently finished my food hike this year. And I had my liver drawn from New Hampshire, and because of some problems I've been having, it came back to my life as an act. And I'm not, he didn't elaborate on it. I don't even know what that means.
Yeah, I honestly, I've not heard that phrase used before. You know, I've heard it said that your Lyme may be in remission, because it's probably much more accurate to say that I'm in remission versus I'm cured. I've still got Lyme bacteria in my body, but my immune system is back in charge. You know, I reached that equilibrium. You don't just take antibiotics, and a lot of people get well without antibiotics. They get well with herbal remedies, but they've got to get their immune systems built back up to be able to take care of the Lyme. Good news is, most people that get bit by a Lyme-infected tick don't get Lyme disease. Your immune system takes care of it. But if your immune system's compromised, you've been inoculated before, like mine and you, then you're probably, when he said that, the tests are still showing antibodies that have been produced, and they may for the rest of your life, quite honestly, that indicate that Lyme is present in your body. So what he may mean is it's in remission because you're not symptomatic. If that's true, though, and I believe it is, that the Lyme bacteria is still there, you got to be really, really careful about taking care of your health. You got to be careful if you ever get surgery again. Anything that suppresses your immune system, another illness, a virus, a car accident, a trauma emotionally, a death in the family, anything that suppresses your immune, stress at work, can allow that bacteria maybe to get a hold again and get the upper hand on your immune system. So I take, one of the companies that's sponsoring me is a supplement company, and I carry the weight of supplements on the trail, and I take them every day because we all know you're not optimizing your diet with ramen noodles and instant potatoes. So I take supplements every day. I do whatever I can to keep my immune system strong. So that may be really what he was meaning by that. Do you have any lingering symptoms?
Well, yeah, that's why I went. I treated myself on the trail with Dr. Sykes. I wasn't going to get off the trail, so I went to the wine, so I was having more in the heart area, which was a pretty strange feeling.
Yeah, my doctor thought I had a sign. I went and got an EKG because she thought I had a silent heart attack because it can attack your heart. I would really recommend, because you know you've had it, going and seeing a Lyme literate medical doctor. That was the smartest thing I ever did, and I spent 2 hours with that doctor the very first appointment, which was more time with the doctor than I'd spent with my primary care physician in the last 10 years combined. We did an exhaustive clinical history, symptom checklist. You know, she quizzed me 8 ways to Sunday, explained how the pathogen worked, and then diagnosed based on clinical examination, which is what the CDC encourages and says on their website. Don't let a doctor use a lab test as a primary diagnostic tool. They're too poor. They can use it to confirm a clinical diagnosis if you get a positive, and that's a double yes. But don't let them throw a lab test at you and say, came back negative. You know, they're just not good enough. Clinical.
I'm in Tennessee right now. Do you recommend this?
Well, I'll say this in closing because this is a great resource for all of you all. You can go to, the way I found mine is you go to an organization on the web called lymenet.org, lymenet.org. It's a patient forum. And this is how flaky it is to find a doctor and try not to get them in trouble and have them be persecuted. You go on and you start a thread saying, I'd like to find a Lyme literate physician in Tennessee. And they will these other patients will send you private messages with the name and address of doctors that treat in Tennessee. I do know there's one near Franklin, Tennessee. Not a Lyme literate medical doctor, but an MD naturopath that does treat Lyme patients. But that's how I found my doctor. A local person in Louisville who actually started my support group, and I met her later on, private messaged me and said, here's one in Ohio, here's one in Indiana. I called them both and wound up being able to get in with the one in Ohio. The one in Ohio has Lyme. 2 of her children have Lyme. She believes she passed it to them in utero. They're all much better, now, and she's practicing. The one in Indiana, her husband 10 years ago was told he had ALS and given 6 months to live. She, being a medical doctor, family practitioner, did not take that laying down, started doing research on her own, treated him with antibiotics. 10 years later, he's her office manager, and he's the picture of health. And that's really common. That, again, I'm not saying 100% of these other illnesses are caused by Lyme, but it's growing more and more common that people with MS are recovering, ALS are recovering, fibromyalgia, chronic fatigue, lupus, autism,